Welcome back, everyone. We have an update from Regen BioPharma Inc. Trades on the OTC Pink sheets under the symbol RGBP. It's a biotech company focused on developing innovative treatments using autologous cell therapies, RNA and DNA-based immunotherapy, and small molecules in the immune-oncology and autoimmune disease space. Please welcome President and CEO David Koos and Senior Scientific Consultant Harry Lander. Welcome, gentlemen. How are you doing today?
Well, thank you. It's good to be back.
Good. All right. Give us your update.
Okay. So basically, I'm going to boil it down. Since we have 10 minutes, I'm trying to push through everything. So the first thing off the bat is going to be the CRO situation and where that sits. So I think Harry and I met this last, what was it? Last little over a week ago.
Last week, yeah.
With the lead candidate to do our CRO research with. I think that's progressing well, and I anticipate having something finalized hopefully by the next conference here. In terms of the timing on everything, Harry, once we get started, what is the time to start seeing results?
I think the whole study will take a year. Normally, with a clinical trial, phase 1 clinical trial, you may have interim results, but because you're focused on safety primarily in a phase 1 trial, in general, you're waiting for the end of the study before you can report results. Also, they typically they lock the data, so it's because it's blinded, so you don't know which patients are being treated or not. You really often cannot report the results during the trial. Okay,
that's good to know. So, and you feel good about the CRO we've initially selected?
Yes. The short answer is absolutely. As you know, we interviewed several, and there was a range of quality, a range of ability to service us as a smaller biotech, and I'm really pleased with the lead candidate.
Okay, excellent. Now, I don't know if there's anything else you think is vital to discussing this, or the reason I'm throwing that out there is because right now, given our time constraints, I want to move on to discussing the stock dividend and the Regulation A offering that we're in the midst of clearing through the SEC. So, part 1, stock dividend. Okay, so we did the stock dividend before on the Reg A or the Series A preferred stock, and that got everybody 2 shares of the preferred. Where they didn't, so they had the 2 shares of preferred, and that really reduces the cost basis that anybody has in whatever series of stock they own, whether it's common or preferred. So now we've come out and said we're going to issue common shares to everyone. So it'll be similar to the Reg A. And the purpose behind it is, 1, I would like to reduce the cost basis of the shareholders. Given the price fluctuations in the stock, I'd like to make it easier to see it way clearer to profitability in the holding. And then 2, I was advised some time ago to do this massive reverse of the stock by a consultant to the company, and that turned out not to be a good idea. And I own that one. It was my fault for making that huge reduction. It dried up the liquidity for the shareholders, and I'm trying to make sure we find a way to fix this so that the shareholders can be happy that they're not locked into a stock they can't get out of. So those are my 2 motivating factors. I think that at the end of the day, the shareholders would like to see their cost basis reduced, which this will help with that. That means that every person that has 1 share of common will have received 2 shares of the Series A preferred in the previous distribution, and now they'll have 1 share of common to go with that. So really, you're looking at a 25% cost basis over what it was prior to the distribution. Second thing that happens is that with that distribution, now you should have some liquidity in the marketplace that we currently don't see out there. So that's going to be very important. Now, how does all this dovetail in the Reg A that we have filed? So we filed a Reg A offering. We're still very much into the nascent stage of the filing. We expect sometime within the next probably, 20 days to get a first round of comments. We expect that it'll probably take 2-3 months before it ever gets cleared. So this is not like you file it and boom, it's done. So the goal here really is to, and the importance of this is that now that we have at least one contract research organization that we believe will meet our needs, I want, desire to be able to move forward with them. And to do that, it's going to take money. So the actual dollar number is probably going to be somewhere in the $600,000 range when it's all said and done for the phase 1 clinical trial. And I want to make sure that we get that through the door. I'm not worried about the fact that we put out there in the filing that we're looking at doing 10 million shares, arbitrary number. The goal here is to make sure that we're financially covered to move forward with the clinical phase 1 trial on hemacellary. That being said, I know that all this has become quite confusing. So I thought today, rather than me sit here and ramble on about what I think your questions are, I would like to have Anna ask us some of the questions that we've received. So with that.
All right. Let's see how many we can get through. Greg asks, do you have any firm commitments of financing for the 20-cent offering? And if so, how much?
Right now, because we haven't gotten to a point that we have addressed any potential issues, we really can't accept firm commitments. We can do soft circling, meaning that somebody says, "I see that," and I'll be happy to look at it once you're cleared. So,
okay.
Yeah. So the long and short of it is, we have a lot of interest, but we can't take a firm commitment on any of it until we clear it.
And how confident are you that you will obtain the financing needed to proceed with these clinical trials?
I am working very hard to make sure this happens. I'm very confident that we will raise the money to get things moving, at least with phase 1 in the near term. I think once we get through phase 1, we'll attract a whole different crowd in terms of financing.
And we have a few questions. I know you're talking about this earlier, Harry, but how long will these trials take before there are some results? Do you have a time frame?
I think it's probably the best thing to say is it's a year. After we get started, first patient in, as they call it, we need a year to report the data. Maybe we could do it sooner, but I suspect it'll take the full year.
Okay. And are there any potential partners you're in talks with that you can share?
The operative phrase there is that we can share. I know everybody wants to know about partners and things like that. those are material events that get disclosed via 8K, and they happen when you have a material agreement that you've entered into. So for me to disclose anything at this point would be out of line. And I know that's not very gratifying, but it is what it is at this point. So we'll have to be patient. I think we've gotten to this point, we've made a lot of progress in a lot of different areas. And I believe that the fact that we see the real value of Heme Accelerate, especially for chemotherapy patients and treating any side effects from chemotherapy, that's a huge market. So I don't anticipate any issue with getting a partner once we've gotten through phase 1.
Okay, well, perfect. We are out of time. We do have more questions, so we will send them to you so you can answer your viewers on your own time. But thank you for this update. We appreciate you both joining us again.
And I say just one last thing.
Sure.
We'll have more time next month because I think that's our 30-minute presentation. We can take more questions. We can provide more information.
Perfect. All right, David.
All right,
Harry.
thank you very much.
Thank you.
Appreciate it.
All right, everyone. We'll be right back.